Hi everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. I would like to talk about some medications that you have to be very careful with in an older age group. Now I'm going to pick a cutoff here of age 65 and over. Obviously there's no cutoff, everybody is different. There are some amazing 65-year-olds who are better than 45-year-olds. But I'm going to use a cutoff of 65 because it's a common one we use. And the reality is that as bodies age, they can become more sensitive to certain medications, metabolism changes, etc. And giving someone who is 30 a medication is not the same as giving someone who is 70 years old a medication. And I wish more physicians actually remembered that. Statistics show that over half, I think it's about 55 or 60% of everyone over the age of 65 is on 4 or more prescription medications. A lot of those medications may well be needed, but many are not, and overprescribing and polypharmacy is a massive, massive problem. So let me talk now about some medications that I consistently find that people over the age of 65 tend to have problems with. And I've seen this time and again. I've worked in dozens of different hospitals over the last few years, up and down the US East Coast. I've worked internationally, and the same problems keep coming up. And if I had a relative on any of these 5 medications, I'm going to pick 5 medications here, then I would want that relative to be off these medications and an alternative to be found. So let's go then. Here are the 5. Number 1, hydrochlorothiazide, HCTZ. This is a commonly prescribed medication for blood pressure. It's known as a thiazide diuretic. It makes the patient pee and it improves their blood pressure, but the problem is that it commonly starts at a younger age and then it goes on for years and years. And I can't tell you the number of times that I see it cause problems in an older person. They may become dehydrated, their potassium could drop, they could become hypokalemic, that's low potassium. And frequently, this is one of the medications that we immediately stop when patients come into the hospital, and we advise an alternative to be found if they've developed a complication. Kidney impairment is another complication. If this medication is used for a long time, or people with kidney impairment, you don't want to be on this pill. Number 2, Gabapentin, also known as Neurontin. I'm really not a huge fan of this medication at any age, but it is prescribed for nerve-related pain, and I see some patients on whoppingly high doses of this medicine. And the problem is, it is frequently associated with drowsiness. It can make people very sleepy, and I often advise my older patients to try to get off it, to taper off it, if it's causing this type of side effect. Number 3, anti-inflammatory medications, specifically high-dose anti-inflammatory medications. There's a class of medications known as NSAIDs. You've probably heard that. Non-steroidal anti-inflammatory medications. Some examples include ibuprofen, also known as Motrin, naproxen, diclofenac. And the issue is that if people are on these medications for a long time, they can eat away at the stomach lining. And there's a process, a physiological process, whereby prostaglandin secretion is decreased and there is a usual protective effect on the gastric mucosa that goes away. And this increases the risk of ulcers developing. And we frequently see in the hospital patients come in, usually an older person, with a gastrointestinal bleed. They'll be bleeding, and then they have an ulcer, which we discover after doing an endoscopy. And when we ask them about their history, boom, they have been on an anti-inflammatory medication, often a high-dose anti-inflammatory medication, for a long time. So while this may be better than being on a narcotic medication, it's a problem if people are on it for extended amounts of time at high doses. So be very careful. Number 4, a medication called Flexeril. The chemical name is cyclobenzaprine. It's a muscle relaxant. It is frequently associated with sedation and drowsiness, I tend to find, if people are on it regularly. There are other side effects as well, including a dry mouth. I'll talk more about that in a moment. But I'm not a fan of Flexeril for extended amounts of time in an older person. Number 5, Benadryl, another very common over-the-counter medication. The chemical name is diphenhydramine. And this medication is often used for allergic type symptoms or itching, but the problem is that it is a sedating antihistamine. It can make people very tired and drowsy, especially an older person. and people get onto it and then they continue this medication. And a far better option if you're looking for an anti-allergy medication is a non-sedating antihistamine rather than diphenhydramine, aka Benadryl. Other side effects apart from sedation include a dry mouth, constipation, urinary retention. It can make people very confused, dry eyes, and these are what we call anticholinergic side effects that you especially need to be very careful of in older people. And there are many medications which cause anticholinergic side effects, and Benadryl is one of them. So there you go then, 5 medications to keep in mind. Be very careful if a loved one of yours or you yourself are on a medication like this for an extended amount of time. Now, of course, everybody is different. Maybe there's some people who take these pills with no problem at all, but I'm speaking from experience. If any older relative of mine was on any of these medications regularly, I would be looking for an alternative. So please remember those 5. Thank you everyone for listening. Let me know your thoughts down below. Check out my online academy and my uncensored platform. Those links are also down below. Hit the like button if you like this video and the bell button for more similar videos in the future. We will talk again very soon.